Hi. In the previous video, I discussed a little bit about the TMJ anatomy, and by this time, you should be able to diagnose yourself and palpate and know whether your pain origin is coming from the muscles, joint, or from the neck muscles. In today's video, I will discuss the symptoms and the common etiological factors, so you can start to understand where is your problem coming from. The common symptoms that TMD patients come with are either it hurts when I chew, I cannot open my mouth. For example, it can be popping sounds and clicking sounds in the joint. It can be ear pain due to non-ear reasons, like they go to the doctor, like we said, and there is no real ear problem. And also it can be headache. And headache patients, please pay attention to this. And really, we have helped many patients with headache just by reducing their TMD symptoms. It has tremendously lowered their headaches and migraines. Also, it can be tooth pain without an origin of any reason for tooth to be painful. There is no decay, there is no pulpitis due to endo reason. So all of these are symptoms that TMD patients can come with. What are some of the major etiological factors? So when I look at my TMD patients and I examine them, I always act like as if I am a detective. I am trying to get clues from the patients about how this has started, so I can try to make my treatment plan based on what really has caused it, because there are many etiological factors, as we will see. One major and first etiological factor is a history of trauma. And trauma is a major factor here, because mainly if a trauma comes to the chin area, like we can see here, and many of the kids do fall on their chin, because the force vector that come on the chin will dissipate all the way to the joint, and it can affect the joint and the ligaments around the joint, and can be the initiator of a TMD pain or clicking, for example. As well as the sports injuries from soccer and rugby and the wrestling and all of that. All those major traumas that come to the face can lead to TMD problems, as well as accidents that come from car accidents, for example, mainly when the car is hit from the back, and what we call a whiplash injury, where we get a sudden extension of the neck. That many times can be a reason to start a TMD problem. Some other traumas can come also from dental treatments. For example, many patients come saying that we have this problem started after we had our wisdom tooth extracted. That can be due to the aggressive or complicated extraction that has happened. For example, if you have buried a wisdom tooth surrounded with bone, and the surgeon needed to do a cut and remove a lot, and it was complicated, took long hours, you had to open wide for a long time, this can lead to overextension of the ligaments and the muscles, and this can start TMD pain. As well as some patients report after intubation for general anesthesia, when they put the tube, it can lead to overextension in the jaw and start also initiating a problem. The second etiological factor is the deep pain. And deep pain is very important that we rule it out, because if we have a deep pain due to a tooth problem, like a deep decay, cavity that's painful every time you eat, you chew, or even spontaneously that needs endo treatment and you are not treating it, this can cause to TMD, because it will lead you to clench your teeth at night subconsciously, because the body usually deals with pain by contraction of the muscles. So that can be a reason for your TMD pain, and you need to solve the tooth problem. Another source of deep pain can be from the neck, like we said. The deep pain that comes from the neck will make us clench our teeth and will subconsciously clench our teeth, and can lead to TMD pain. The third reason is the emotional stress. And we know that now it's becoming a common problem worldwide that many people are stressed. a lot, and depressed, and has anxiety issues and panic attacks and so on. And they found that stressful events in our life, in this study, they were looking at the amount of contraction of the masseter muscle at night for people throughout their different events in life. And they found that when we have a stressful situation, like I'm going for a job interview, or I fight with my father, or I quit a job, that the masseter muscle is active at night subconsciously without our conscious will to do that, because of the stress that we have during that day. Versus if I have a vacation and I go to Hawaii, of course I am relaxed and I will not have the clenching on the teeth and the bruxism at night. So it is extremely related, mainly for people who have bruxism and they are trying to find solution. There is no real solution for bruxism other than reducing the emotional stress. And I think the time we are living in now with this corona quarantine, as I am recording this video, we are all quarantined worldwide. It's perfect time for us to really reevaluate our life and see what is really important for us. Because during this quarantine, we all have come up to the conclusion that our health is priority number one. It should be priority number one, because what served us during this time is our health, and we all figured out that everything else can wait as long as our health is premium. So our health is not only the physical but also the emotional, and I will talk about stress in details in other videos. So it's very important that we rule out the stress and we start to really see what is really important in our life and prioritize our health and make it optimal. The other factor is the parafunctional habits. And the parafunctional habits are any habits that we do that can lead to excessive pressure and stress on the TMJ. And those practices are things like clenching, not only at night, but even during the day. Some people have this habit of clenching their teeth together subconsciously, and this can lead to over fatigue of the muscles and over pressure of the condyle itself. So we need to start to pay attention to our clenching at day, and I'll give you some tips later on. Some other habits, like people who are they chew their pen or their nails, because all of this will lead to constant elongation of the ligaments in the condyle. So we need to pay attention that our mouth and our masticatory complex should not be used other than eating, speaking, and swallowing. Other than that, we should let it be relaxed. Other habits can be, holding the phone on one side. This will lead to tension and overextension from one side. So this will lead to imbalance. Sitting postures, and posture is a big factor here, and whether for us or our children. And to be honest, I am really worried about the new generation, our kids, how much time they are spending on electronics and on their iPads and laptops in bad posture, and they are growing into this bad posture. I really hope they will not end up with a lot of pain and muscle problem, because the problem is that when they are growing in a crooked way due to their bad posture, this makes the bone also grow crooked. So they can have scoliosis and all the consequences of imbalanced right and left side. Mainly that they are not also doing a lot of exercise and they are not moving a lot. So we need to really pay attention to our kids and make sure that they are at least active and they are sitting in good postures when they are spending time on their electronics. Same thing with us, of course, because many of us are spending many hours on their electronics, and I'll give you tips again later on about how to have better posture. And finally, and last but not least, is the occlusion. Some patients, their occlusal situation can be contributing to their TMD pain, and we might need to do orthodontics or prosthodontic work to help their TMD situation, but it's kind of a tricky, and we have to think about it deeply before we move on to that step. So I hope today you have understood more what is the reason behind your problem and I'll see you in the next videos to discuss more in details about TMD.